The contagious Delta variant is causing a rise in COVID cases, and it's prompting more people to get tested. Take a look at these long lines. This was the drive-through COVID-19 testing site yesterday in Fishers. Here in a second, right there, you'll see just how long the line was for people waiting to get tested. The health department added staff again after lines got long the last couple of weeks, with about 300 tests a day. The testing trend in Indiana since May 1st shows the 7-day average dropped below 9,000 in early July, but has now climbed back to almost 23,000 people getting tested daily.
I would attribute it to the rise in cases and contacts who've been identified as part of the Delta variant being much more highly transmissible than the previous variants that we've seen. School's back in session, so there are more opportunities to be identified as a contact.
More than 600 locations around the state still offer COVID testing, including pharmacies like CVS. Now, if you're experiencing symptoms, they want you to get a COVID test, and in most cases, you do need an appointment. You can find a location and how to sign up at coronavirus.in.gov. More Central Indiana school districts are requiring masks starting on Monday. Hamilton Southeastern, Noblesville, and Carmel Clay schools are now on that list. They're going to require everybody wear masks indoors. Hamilton Southeastern had 80 positive COVID cases so far, more than 500 students identified as close contacts, and Noblesville schools had 3 major outbreaks this week. They're also encouraging students and families who are eligible to get vaccinated, and they plan to host a vaccine clinic at the Noblesville Schools Community Center coming up in a couple of weeks on August 25th. Now to the latest on a booster shot against the virus. The CDC director is expected to move quickly to approve a committee recommendation for those extra shots. This is for Pfizer and Moderna. Those third doses will go to organ transplant recipients, cancer patients undergoing treatment, and people with compromised immune systems. If you are in one of those categories, make sure you get the same vaccine you originally got. It needs to happen at least 28 days after your second shot. At this point, the CDC says there's no data to support the use of an additional dose of the Johnson & Johnson vaccine, but that's not stopped some people from getting another dose. About 90,000 people who got the J&J vaccine got at least one more dose. More than 1 million Americans have already gotten a third dose of Pfizer and Moderna's vaccine.